There's a lot of factors to consider when we want to recommend what to do with a patient's aneurysm, whether to treat it or not to treat it. A lot of times with smaller aneurysms, for example, we tend to watch them, get an MRA or a CTA. Those are studies that look at the blood vessels of the brain every year for a couple of years and then less often as time goes on. The purpose of getting those scans is to make sure that aneurysm is not growing. Remember, an aneurysm can grow, but it grows very slowly. That's why we wait a year or so before we repeat the scan. A lot of times those small aneurysms will not grow and end up not requiring treatments. If they do show that they're growing, then we would probably consider treatments. The factors that really we consider in determining whether to treat an aneurysm are its size. The larger, the more dangerous generally. Its location. Sometimes, for example, the aneurysms that occur in the back of the head are a little bit more dangerous than the ones that occur on the front of the head for reasons that are not really clear to us. Also, whether the patient is a smoker. Smokers that have aneurysms that are at higher risk of hemorrhage than a patient who's not a smoker. And again, in a minority of patients that have a family history of aneurysms, those aneurysms are also relatively more dangerous, and we tend to be more aggressive in recommending treatment. If we take all those factors into consideration before we come up with a recommendation where an aneurysm needs to be treated, it's a risk-benefit ratio. What we want to do is we want to have the benefits outweigh the risk of the procedure.